Hey, how's it going? Dr. William Pleau here. This is the first in a series of videos I wanted to do about some common pain conditions and how I address them with my approach and my perspective. So to start, I thought I would be talking about shoulder pain. Shoulder pain is pretty common and it's kind of a good jumping off point. You know, I don't need to be the typical chiropractor and start with spine. I felt like starting with shoulder, so for that reason, we're going to start with shoulder. So the first thing is, when a person says they have shoulder pain, I want to find out, like, where does it hurt? Because if it's up here, that's totally different than shoulder pain that's out here, or shoulder pain that's maybe back here. So where does it hurt is the first step in determining what is the pain generator. The pain generator is that particular tissue or structure that is irritated, inflamed, and causing the symptoms. So we can do an orthopedic evaluation to determine what the pain generator is. Typically, it's going to be perhaps a ligamentous structure, maybe the biceps tendon, could be the rotator cuff or the glenoid labrum, or it could just be the belly of a muscle that's under stress and is irritated. But then I want to look a little bit deeper. I ask the question, why is this structure under so much mechanical tension that it's becoming overstretched and inflamed and irritated? So then I want to look at what is the deeper vital structure that the shoulder is trying to protect. To talk about that a little bit more, I thought I would invite my friend Isaac. Come on over here, Isaac. So one of the key vital structures in the shoulder is a structure called the brachial plexus. The brachial plexus is a big bundle of nerves that come out of the side of the neck and kind of runs right underneath the collarbone here, underneath the muscles, the pectoralis muscles, and then runs right down the inside of the armpit. And there's a major artery coming up off the aorta called the subclavian artery that's going to follow. It's going to come up and go over the first rib and right underneath the collarbone there, the clavicle. And the subclavian artery is kind of wrapped in and surrounded by the fibers of the brachial plexus. So you have this big bundle of really vital, important stuff. Big old artery, bunch of nerves. You know, without that artery and the nerves, on nothing in the arm works, right? So the body needs to protect this big bundle of arteries and nerves. So that's why if you have changes in the movement patterns of the shoulders, the upper ribs, the cervical spine, the neck, a lot of times that can be because the body's trying to protect some sort of restriction, some loss of movement or glide in that big old bundle of arteries and nerves, the brachial plexus and subclavian artery. So that's a common place where I will look and sometimes find restrictions, and it's just a very, very gentle touch to release the tension and restore normal glide and normal freedom of movement of that big vital structure. Once you do that, a lot of times the irritated tissue that's your pain generator, those ligaments in the shoulder, or the muscle tendons, or the cracks in the cartilage of the shoulder, it can then start to heal because the shoulder can go back to normal pattern of motion. Basically what we're trying to do is we're trying to take away the need for compensation by the muscles and joints so that things can heal again. So good, we'll do this again very soon, and I'm not sure what we're going to talk about next time, maybe hip.